What's up, guys? Wanted to make this video for everybody in the F&B community, and I reached out to Karen. She gave me the okay to post this on the F&B Collective. You guys are probably starting to see all the advertisements for open enrollment and find affordable health insurance and blah, 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 blah. Every year we go through the same thing. A bunch of people sign up through other agents or other agencies that turn out to be shady, or maybe didn't tell them everything that was going on, or you guys just didn't understand what you guys are signing up for. And I want to take the opportunity to actually go through some tools with you guys so you guys can actually learn what to look for and what to do when looking for a health insurance plan. I get it. It comes up every once in a while in the conversations in the F&B Collective Facebook page, because a lot of you guys work for smaller restaurants and they just don't have the resources to offer a traditional health insurance, group health insurance plan. This information is free to anybody to use. I don't care. Share it. Click the link. Mess around here. You can't break it. This information is also not unique to me. So by no means am I saying, hey, you got to use this to do your health insurance for next year. There are other good agents out there, especially in and around town. And guys can feel free to tag them in this if you want to. I don't care. This really is just about getting you guys the right information. So if you click the link, it's either going to be up there or down there or wherever the hell it is on whichever platform you're on and watching this thing. It'll take you to this page right here. You just have to put in some basic information. I'll fill it in with some random stuff. You guys don't have to put in your email or phone number if you don't want to. I'm the only one that's going to see this stuff, and quite frankly, I don't feel like harassing people with nonstop emails and phone calls. So put it in, don't put it in, that's fine with me. This is the next step to it. All right, where do you live? Select your county. Yes, you want to see if you qualify for a subsidy. Put in your age, your gender. Right here is a big one for everybody at F&B. I bartended in Charleston for about 10 years, so I get it. Everybody's usually smoking something. They're talking about tobacco, specifically tobacco right here, right? And if you ever have a question about what they're specifically asking you, just hover over this icon, right? Like this one, they say they're specifically asking you, do you use tobacco 4 or more times per week for the last 6 months? If you just started smoking 2 months ago, this answer is no. If you only smoke 3 times a week, this answer is no, right? If you are an everyday smoker and you've been doing it for 27 years, then check the box, right? If not, don't worry about it. You can add your spouse. You can add a kid if you want. It's pretty easy. Just click on the button, and then you can add them. How many people are in your tax household? Very important. Tax household, right? Again, you can hover over this if you want to, just to make sure. If you're 26 and you have 2 roommates, this is not 3. You're not claiming your roommates on your taxes, right? It's just 1. All right, so go back to your taxes, see where your tax household was. If it's single, it's just 1. Right? Your estimated 2024 income. Put in some information here. What they're asking you is, what are you going to claim on your taxes? Again, one of the best parts about bartending in Charleston was the cash tips. I'm not saying don't claim your cash tips. I'm not an accountant. I'm not an attorney. But if you guys aren't claiming your cash tips or claiming only some of your cash tips, that's what they care about. They care about what you're going to be putting on your tax returns next year. Okay? Hit continue. And it's going to pop this thing up, and it's going to say, hey, you qualify for these savings. Fantastic. Hit continue. Next, if you guys have a doctor, I'll put my guy in here. You guys can see him. Cool dude. Put your doctor in here. The reason why you're putting your doctor in here is because you want to make sure whatever your health insurance plan is actually going to cover your doctor. If you guys don't have a doctor, then just leave it blank. Prescription. Very important. They're looking for the actual name of your prescription, not what you call it, right? For example, I tell everybody I take Crestor. I don't actually take Crestor. I take this thing right here, which is the generic version of Crestor. Just going to copy, paste it in here, scroll down, and yep, it's the oral tablet. It's generic. I'm going to select this one, You can select your however many milligrams or whatever you do for it, and continue. Again, you just want to make sure that whatever plan you're choosing actually covers your medication, because they don't all do, as you're about to see. And it's going to spit out this. These are all the plans available to you guys in South Carolina. Doesn't much matter to me which one you guys choose or which one you guys looked at. I'm appointed with all of them. But here's a perfect example of why we put that information in right here, right? My doctor does not take this plan. And whenever I go and get this prescription refilled, it's going to be a $250 copay after the deductible, right? So while this policy looks like it's not going to cost me anything, every time I refill my prescription, it's going to cost me a couple $100, and it doesn't take my doctor, right? Whenever you guys get to this point too, you can hover over some of these things like health deductible, and it'll explain to you what it is. Max out of pocket, which is essentially the most that you can pay for your health coverage, right, in any given, and in this particular year before the rest of it is covered by insurance. And it gives you some highlights right here too. But again, I like my doctor, so what I need to do is I need to find a policy that takes my doctor. This is the first one right here, Blue Cross Blue Shield. He takes his plan. It's going to tell you he takes his plan, and all of a sudden now, whenever I go to get my prescription refilled, it's only a $29 copay. So a lot of people get stuck on this deductible thing right here, right? They're going to say, well, this is a $7,200 deductible. This is a $0 deductible. Why in the world would I choose the Blue Cross one as this one right here as opposed to the $0 one? It's pretty easy, because I'm going to spend $201 less whenever I go and fill my prescription, which is monthly, and it also takes my doctor. So that seems like a win-win to me, right? And you can keep going through all these things. There are tons of them. There are literally hundreds of options, right? Another thing I think you guys should do is, you guys look at this, hit the word benefits, and it'll actually bring up, like, legally what this policy is covering, right? It'll give you a description of it all. For example, if you go to see a specialist, this is a 0% co-insurance. If it's a network, great. That's exactly what you're looking for. 0% co-insurance, which just means co-insurance means the percentage that you're responsible for. So if, for example, I'll click one that does 0% co-insurance. Let's see. Co-insurance. So like right here, diagnostic test, 50% co-insurance. That means you're on the hook for half of that bill. So if the x-ray costs $250, you're on the hook for 125 of it. Okay? That's what co-insurance means. So when you guys are kind of figuring out these policies and which one's the best fit for you, absolutely click on a couple of them and actually go through it and see what it's actually covering and if it's a right fit for you guys. You're going to see this blue Virtue Connect. This is new. What this policy basically is all via webcams and chats with doctors online that you can do. So it's really geared towards, now I can't remember what it's called, but it's that online doctor experience where you don't necessarily have to go into the office. You can go in to see a doctor if you want to, but it's definitely geared more towards that virtual experience. If you guys see anything, let me find one here, especially Blue Cross Blue Shield that says Cooper on it. Right here. Like Blue Cooper Standard Bronze. Whenever you see this word Cooper, what that means is this is going to be an MUSC only product, which means the only doctors in this will be at MUSC. Okay. Now, does that mean you can't go to urgent care? No, absolutely. You can still go to urgent care. Does that mean you can't go to the ER? Absolutely not. Definitely still go to the ER. It's just what you guys pay for is going to be dictated by where that hospital is and where that doctor is and what hospital system they're a part of. Okay. So just be aware of that. If you guys do Cooper, it means that Roper is not going to take it. Okay. Now, if you want to compare multiple plans at one time, it's pretty easy. Let's say you wanted to compare this one. Oh, I'm just putting some down here. I don't really know. I don't really know or care which one it is. It'll add all three down here. You guys can hit compare, and it'll give you a side-by-side comparison. All right, so you guys don't necessarily have to keep clicking into them, clicking out of them, clicking into them, clicking out of them. All right. Another thing to take into consideration are the medications. Right. So one of the things that when we look at these is if you're on some medications, you're going to want to pay careful attention to these right in here. As you can see, everybody really focuses on this tier 1 and tier 2, which is the generic stuff. But a lot of times people don't have generic medications. So what you're going to want to do is you're going to want to make sure that wherever your medications line up in here, you're taking that into account. If you're not sure which ones they are, all of them have like this drugs tab where you can click drugs, and you're going to do individual, marketplace, and family plans. Standard plans cover drugs. And this is where you can actually just start inputting other medications. I pulled up some here. Like this is a popular one that we see a lot of times. There, hit search. Here it is. See, so this is one that's a tier 2 for Blue Cross Blue Shield, right? So if you're comparing plans and you take this medication, just know it's a tier 2. So when you're back looking at all of these benefits, you know that one of your medications is going to be this guy. All right? All this to say, don't necessarily just always look for the one that's 0, like this guy right here, 0 and 0, because it may just not cover anything. That could be why it's free. If you guys look through this and you don't have any questions, you're like, yeah, I just don't want to be harassed. I don't want to deal with any of this stuff. Just freaking sign me up for a policy. You guys don't have to talk to anybody to do that. You can just do right here, add to cart. I'll say, yes, this one. Yep. Start application. It will bring up this if you want to. Just yes. Or if you don't give a crap, you can always do no, continue with this application. Man, these are all AM better. I prefer Blue Cross. AM Better's network is getting better, but Blue Cross's in Charleston is still the ideal one. And then you just go through this information. It's pretty basic information. First name, last name, date of birth, social security, all that other great stuff. And you guys can go in here and mess around with it as much as you want. If you guys have questions, absolutely send me a personal message, and I'll be more than happy to help you guys out if you guys get stuck or you guys have a question. Or like I said, if you guys had a great experience with somebody else last year or the year before, or whatever it is, I mean, feel free to tag them and let other people know. That's perfectly fine with me. But thank you again, Karen, for letting me do this. Like I said, I hate running into people 6 months from now when they go to the ER and they find out their insurance didn't cover jack shit because some shady idiot sold them some stuff via 1-800 number or whatever it is. So again, you guys have any questions, let me know, or reach out to anybody else that'll undoubtedly get tagged in this. I have no idea what type of plan RB sells, but if you guys know, feel free to share. All right, guys, thanks.